Hey guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. So if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. Okay, so let's get started. All right. I take all the questions if you are brand new. I take all the questions from emails, from video posts, and from Instagram, and I put it all into one episode, and here we go. All right, first question. Any tips for the AHIMA coding books? So what the viewer was referring to here is the tabbing of the books. When you are going to go take your exam, is this okay? So according to the website, they have a list of all of the approved books that you can use. If you are going to tab when you are sitting for an AHIMA credential exam, those tabs have to be with the original book. They have to be a part of the book. Now, the CPT AMA Professional Edition, they are the only ones that I know of that have tabs in them that you can use. I don't know about the ICD-10 book because the ICD-10 books that I use are by Optum 360, which I love them. So they don't come with tabs, okay? I'm old school, all right? When I took my exam, none of my books were tabbed. Not a one of them. So I am used to having no tabs in the books because back then it was that way where we couldn't have tabs. And now they're saying that if it's a part of the book, then yes, you can. Other than that, your book has to be clean. I mean, completely clean. If the tabs did not come with the book, then you cannot use those. So reference the AHIMA list on the AHIMA website, ahima.org, AHIMA.org, and you'll be able to see which books are approved, okay, whether it is an AMA edition or whatever. But I use Optum 360 for the ICD-10 CM book. I use the Expert for Physicians, okay? So the AMA Professional Edition for the CPT, you do need that, though. That is required. They do not allow any other CPT book, okay? So that's it on that one. All right, next question. What are the differences and benefits of AAPC versus AHIMA? So that you have to do on your own. And now I have plenty of videos out there where I talk about the differences between the two. So if you like, please view my, my videos. I have plenty. And I do talk about the differences between both. But when it comes to this question, it's really subjective. So you guys really have to do your research. I mean, I get this question about 10 times a week. So I put out plenty of videos in order for you guys to reference those. So please do that, okay? Next question. Will there be a pay cut for coders, especially new ones, since the computer is assisting? What the viewer meant was the computer-assisted coding. I talked about that on another video. And that is a program that is not quite out yet, okay? It's still in beta in some places. They do have some, but not fully, okay? These computer-assisted coding is supposed to assist. It's not going to take the place of medical coders. I do have a video that I did last week about what is computer-assisted coding, and it's not going to take the place of a medical coder. We still have to have somebody to look at the documentation, to reason it, and to think about, you know, what is the provider saying, because the computer is only as smart as you're telling it to be. The computer is only going to pick up the things that it sees because it's recognizing things. It doesn't have the ability to reason and think, oh, well, the provider meant this or the provider meant that. So that has no bearing, whether we're using computer-assisted coding or not. It has no bearing on a medical coder's salary. And I've always said that if you are curious about what a medical coder makes, you can visit the Department of Labor or the Bureau of Statistics, and they will be able to tell you what medical coders make in your area, because every place in the U.S. is going to start their coders off at a different rate. There's also other factors that go into it as well. Is this a public hospital? Is it a private hospital? Is it a government hospital? A lot of different things. This is a specialty that you're trying to get into, like oncology coding or whatever the case may be. So that is something to think about and consider. So that's my answer on that one. Next question. I am a CST, a certified surgical technician. I have worked in the main OR and currently work in labor and delivery, and I am interested in medical coding mostly for the opportunity of being able to work remote. Would having this background help me with getting a job? No, not technically, because if you have like other experience, like being a nurse or being a medical assistant, or in this viewer's case, she is a surgical technician. Yes, while you'll have the background of your medical terminology, anatomy, and physiology, which is really great, you don't have experience applying hands-on codes, okay? And so that's what they're looking for when you are looking for a job in medical coding. Now, there are many ways to get a job without experience. This is probably the #1 complaint that I hear and that I've been through myself, where how are you supposed to get a job if no one will hire you because everybody wants experience? Everybody goes through this at the beginning as a medical coder. So you can apply with a temporary agency. There was a temporary agency that specialized in medical professions in my hometown. And so that was where I was able to get my first job, because basically they just need somebody to fill in a seat. Okay. They need a body to be in the seat in order to work for the day. Okay. So all of your temporary assignments get to be put onto your resume, and there is your experience. And that's how you can get your foot in the door. So there's that way. You can also apply with medical billing. Although it will not give you hands-on experience with coding, it will give you a start, okay? And usually medical billers work up to being medical coders, okay? You can also apply with medical records. Medical records will get you around the people that are doing the hiring, okay? And I talk about this a lot as well. It's all about making connections, and it's all about being persistent. You still have to apply everywhere, even regardless of whether they are asking for experience or not, because sometimes you can get lucky and they will take a chance on you. But when you are, you need to be prepared, because they are going to give you a test. They're going to give you an assessment test to see how you do. If you pass this assessment test, then that means they're going to give you a shot usually, okay? So make sure that you're staying on top of the coding, and make sure you stay on top of practicing so that you understand what's happening, okay? When you are taking your tests, you'll be prepared, okay? Now, I'm going to be doing episodes later on about this, so I won't talk too much more about this one. But one other thing I wanted to mention too, if you are getting into this for the sole purpose of starting in, because you want to be a remote coder, COVID has changed the game a little bit. Normally, you have to have experience in order to code remotely. However, if you are still applying at a place where you have to physically go, a lot of places are having their coders work remotely. I do have a viewer who just barely got her credential. She was very persistent, and she got a job, and they have her at home right now. She applied at a place where she has to go, but they said, you know, we're going to have you coding at home because everybody's at home because of COVID. So with that said, don't count on this, okay? Do not count on that you want to do this because you want to work remote immediately. You really do have to be around people your first job, because book coding and real world coding is two different things. And a lot of times it's a really shocking wake-up call when people get out in the real world and they start to code, and they find out it's completely different from what the book, okay? The book is going to give you textbook examples. When you are out in the real world, you're going to be dealing with providers and their moods and their attitudes, and if they are wanting to be detailed that day or not, you know. So there's going to be a huge difference, and I always tell you guys this because I want you guys to know. So like I said, if you get a job right now and they have you working remotely, you're very lucky, okay? But this is not the norm, and I just want to let you guys know this. This is not the norm. So if you're trying to apply for remote positions, they're probably not going to let you still. But if you apply with places that you have to physically go, they may let you work remotely until this thing with the pandemic gets under control. Okay? So next question. Hi, Blue. you mentioned in your previous video that you specialize in orthopedic and podiatry coding. May I know what certification is that, AHIMA or AAPC? So I don't think I ever said that I specialize in orthopedics or podiatry. I always say that that is my favorite specialty. Not that I specifically have a credential that specializes in that. AHIMA does not have that. AAPC is really good for that. They have a slew of different specialty credentials, and that is not what I have. I am certified with AHIMA. So AAPC has that if you're looking to be a specialized coder. I will say this though, when it comes to the specialized credentials like that for the different specialties, when I'm looking for jobs for my show prep, right, for the job listings explained, very rarely have I ever seen them ask for specific credentials like that. So I would consider it very carefully. You don't want to get a bunch of credentials, because if you don't have the experience, number one, to back up those credentials, you're basically wasting your money, all right? Most people can go their entire careers with just one credential and do just fine, okay? If you are getting a bunch of credentials, while it looks impressive, it's not going to get you in the door much faster. It will, all you're going to have to do is basically come up with more continuing education units to maintain those credentials, because every single one of those requires you to have continuing education units. Now, how many it is going to depend on which association you're with and how many they're going to require. There's different requirements. I also did a video about this before, which I will probably leave in the description box below. So you can look into that. But I would strongly caution you that if you are considering getting a specialty credential, that you think about it and think about the benefits, weigh the costs and the benefits, and see if that's really the path that you want to go. Okay. Next question. By any chance, do you offer a class about medical coding? I want to self-study, but the books are expensive though. So I am not a certified teacher. I say that all the time, okay? I am just a lover of medical coding, and I like to share the things that I know. I like to break things down. Do I like to teach? Of course. Am I an official teacher? No, I'm not. But I do have a Patreon channel, and that Patreon channel, patreon.com/medicalcodingwithbleu, all one word. I do have coding exercises on there that I come up with, and I talk about the rationale and how did I get to those answers, and we talk about a bunch of things when it comes to medical coding. And then of course I talk about myself, because it is Patreon, and I think that my patrons deserve a little bit more of me, okay? I try to stay focused with YouTube. I tried to make it about medical coding, and I've gotten backlash a few times about that. People just accusing me of horrible things. But I try to stay focused because the name of the channel is Medical Coding with Bleu, okay? So that's why I keep all of my other personal stuff on Patreon, and I talk a little bit more about all just different things. So if you're interested, I do have pledge levels that start out at just $1 per month, and you get access to all of that. I pretty much give my patrons access to everything, and it's just $1 a month. And if you sign up this month, I'm doing the pledge drive. So if you sign up this month, you get put into a drawing to win one of 3 prizes. And I'll do the drawing on the 30th live on YouTube. And it's just one-on-one study sessions with me, either coaching or tutoring, okay? Done via Zoom. So first place is 90 minutes, and it doesn't have to be the full 90 all at one sitting, although it can get very involved, okay, with the conversations, but it can be 2 45-minute sessions. The second prize is 60 minutes, and then the third prize is 30 minutes, where you can just talk to me via Zoom. So I hope you'll take a second and view the page and see if you're interested, and, you know, hopefully you win, all right? So yes, that is what I offer, okay? Next question. Are AHIMA credentials geared towards the hospital and AAPC more for the outpatient? So I hear this a lot, and there's a huge misconception with this. So with AHIMA credentials, it's not just the hospital. I work in an outpatient setting, okay, in the hospital. So you can work in a hospital but still be outpatient, all right? It's not going to make a difference. The CCA is the beginner level credential. That is the one where you have no previous experience and you are just basically, you know, prepared to do anything when you start in medical coding. Now, so you can do inpatient if that's what you want to do, but it is mostly the outpatient setting. There are inpatient questions, but it's mostly outpatient. CCSP, the certified coding specialist physician based, is more of the outpatient setting. That is where you are specializing in outpatient. And the CCS, or the certified coding specialist, is both inpatient and outpatient. That is the gold standard of medical coding credentials, because in one credential it says that you can code both inpatient and outpatient. So that is a misconception about that AHIMA is only for the hospital. Lots of people have AHIMA credentials. They are on the outpatient setting as well. So don't believe everything you hear. It's usually people who don't really know that say those things too as well. So it just depends where you're applying and what credentials they are looking for. Again, I will be doing that video on Friday, the job listings review. And they're everywhere, okay? They're, you know, doctor's offices on the outside and they're in the hospitals. So, you know, it is pretty much wide open. So, next question. Okay, no way. Here we go. Oh, do you have to have an associate's degree or are you okay with just a certification? You don't have to have a degree to be a medical coder. Okay, you don't have to have an associate's, or you don't even have to go to college. As long as you are certified, you're good to go, okay? And certified through the American Health Information Management Association or the American Academy of Professional Coders. Either one of those is totally fine. You can look and see in your area which credential are they asking for the most, or which association their credentials are looking for more, if you are unsure about which association to go with, okay? That's just one tip that I have about that. All right. And then the next one, or the last one, is, hi, I'm going to new for medical coding next week. I think they mean that they're going to start medical coding next week, like a school or something. Too scary after I saw your videos. Can you help me? And then nothing. They didn't say anything. They didn't say anything else. Help you with what? This is the thing that I'm telling you guys. If you're asking for help, I don't mind, but you've got to be specific. If you tell me, can you help me? Okay, help you with what? You know? And if what I'm saying is making you scared, how do I say this? It shouldn't make you scared because it's the truth. And I say things very bluntly because I feel like if you're coming here and you're looking for answers, I'm not going to sugarcoat it for you, because the shock of being on the outside and being in the real world, and then all of a sudden you're dropped in and then you're encountering things that you didn't expect, is, I think, more detrimental to a brand new coder than hearing from somebody who is a medical coder, who really loves it, who is really not trying to scare you, but is telling you the truth. I would rather that than the shock of, gosh, what did I get myself into? Okay, because so many people, when I hear and I see them comment on other things, sometimes I look at the other schools that are offering medical coding programs, and I hear and I see the complaints. And they're complaining because they say, well, I spent thousands of dollars and I can't even get a job, or I spent thousands of dollars on this school and they didn't teach me anything, and now I'm stuck with this student loan debt. So this is why I talk very frankly about what happens in the real world of medical coding, and I talk about all the experiences that I've had, because I think it's important to share this information. Does it put some people off? Probably so, because I've gotten a few ugly comments before, and it doesn't bother me, because to me, I'm not saying these things to be malicious. I'm saying them to be real. And this is me up front telling you guys this is what is actually happening. So, you know the expression, you can please some of the people some of the time, but not all of the people all of the time. I'm pretty sure that's my that's something that happens with me. But and I can tell even when I'm at work too, because sometimes when there's detail that's missing and it's not there, and I bring it to the attention of the people that need it, they're not really happy about it. But then later, when they see their productivity and their numbers going up where they're supposed to be appropriately, then they're like, oh, okay, then they're singing a different tune. It's the same thing here. I would rather you guys know and be like, wow, I didn't know all of this. No one ever said. I'm not going to be one of those people that will just sugarcoat everything and say, oh, yeah. And I won't even say that medical coding is for everybody, because I've always said it's not for everybody. If what I'm saying is so scary, think about why it is worrying you, okay? And sometimes it's just because it's something that's brand new. And don't let that intimidate you into stopping from doing what you were wanting to do. You obviously looked into it for a reason. You obviously wanted to do it for a purpose. And so it's up to you to follow through. And like I said, I'm not saying these things to put you guys off. I'm just saying these things to be real, okay? And there's, I mean, there's really nothing else that I can say to that other than, you know, I'm just being real about it. So I probably earned a couple of dislikes on that one, but it's not meant to be that way. It's meant to be real, okay? And I think as adults, we're all adults here. I would rather know the truth than have somebody lie to me. I've never, that's one thing I don't like, is dishonesty. I value realness. I value honesty. I value knowledge. Those are the things that, they're hallmarks in my life that I project every single day. And I insist on honesty, but at the same time, I want to learn things and I want to be able to grow. And because of this, I think that, you know, it's sometimes the way that I come across, you know, and so without that filter of sugarcoat, you know, it does, I guess some people are just more used to the sugarcoat. And I came up from a generation where not everybody got ribbons for participating. We had to earn, you know, trophies and things like that if we wanted a trophy. Not everybody got a trophy. And that's my generation. That was how we did things, you know. And like I said, a lot of times I'll say I'm old school. So I believe in, you know, work hard and play hard. I mean, I do. Because a lot of blood, sweat, and tears goes into this. I'll tell you right now, a lot. You know, did I have days when, do I have days that medical coding makes me cry? Yes. Because it will put up a fight, especially when you're trying to learn things. I still even, you know, get frustrated even now when I can't grasp, when there's something that is frustrating me and I can't grasp it right away. I get frustrated too. So it's just a part of it. But my love for this overrides all of that frustration. And that same energy stays with me long after I have this, you know, I have great days and, you know, I have the euphoria from those days, right? Because you have great days. It's just like, hey, this is awesome. This is great. But then on the days when it's like really kicking you in the keister and you're like, well, wait a second, am I doing, you know, what am I doing? I can still maintain that same energy because I am committed to this. It is a commitment. It's not something that is just really easy, you know. And I've had people that say, well, I want something that's easy. I want to be able to go in and do what I'm assigned to do and go home. This involves critical thinking every day. Every day. It involves critical thinking. It is not cookie cutter, because think about this. Every patient is unique. Every situation is unique. So this is not a cookie cutter field. You're not going to always do the same thing over and over again. And if you are doing the same thing over and over again, you're really hurting yourself, because as a coder, you're not growing. And you got to constantly be willing to grow when you're doing this field. Okay, so that's just my thoughts on that one. I mean, I do have some pretty good shows coming up this week, so I hope you'll stick with me this week. And if I say something that you don't like, give me the benefit of hearing me out. Okay, at least you can do that. Just at least do that. At least hear me out, because what I'm saying is probably going to make sense along the way. Okay, so like I said, I do it because I care about the viewers. I care about you guys, you know, and I care about whether or not you're getting good information or not. So I'm always going to try to give you the best information that I possibly can, even if it is blunt. Okay, so I'm going to wrap it up there. But I hope you'll join me tomorrow. And thank you very much for tuning in. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.